FCPS exam, different questions that are asked in May attempt. So the first one is biotin. Vitamin B7 is known as biotin is a cofactor for which carboxylation deficiency. Multiple carboxylase deficiency happens. ADH axon collecting duct. ADH axon collecting duct or water reabsorption. Non-septate hyphae with wide angle branches will be in mucor. It is fungal non-septate hyphae. Pancreatitis causes deficiency of which vitamin? Vitamin D deficiency causes pancreatitis. Fluid in skin blisters, burns is known as serous fluid. It is serous fluid. A patient has HB9, normal APTT, and normal PT. What is the best management plan for this condition? That is packed cell RBC transfusion. Next one is a patient has primary amenorrhea, blind-ended vagina, inguinal masses are there. What is the diagnosis? It is androgen insensitivity syndrome. It is the diagnosis. Next one is polycystic ovarian syndrome. FSH-LH ratio is there. Ratio is greater than 2:1. The floor of acetabulum is formed by primarily ischium bone. In asthma, major sites of airway flow is obstructed is terminal bronchioles are obstructed because of mucus plugging, thickening of the mucosa of bronchioles, terminal bronchial mucosa thickening leading to airway deficiency and shortness of breath. A beta 2 agonist relieves bronchospasm by increased intracellular cyclic AMP. Next one is which estrogen is secreted highest quantity? That is estradiol. Low level of FSH LH with abnormal uterine anatomy dysfunction is in hypothalamus. Rotterdam criteria for polycystic ovarian syndrome requires any two of the following three features except that is elevated prolactin level. First line of medication for management of endometriosis is oral contraceptive pills. Persistent elevated HCG treatment is methotrexate. Chronic smoker reduced FEV1 with FVC. What is the diagnosis? That is emphysema. Post streptococcal glomerulonephritis patient will have hypersensitivity. What type of hypersensitivity will be? It is type 3 hypersensitivity in post streptococcal glomerulonephritis. Next one is endometrial carcinoma. First metastasized most commonly to the lungs. Endometrial carcinoma metastasis to the lungs. Okay, next one is exposure to the aromatic hydrocarbons like benzene, propythiol is strongly associated with which cancer? That is adenocarcinoma of the cancer. Another one is bronchogenic carcinoma or adenocarcinoma are mostly associated with the mesotheliomas. So in this way you have to memorize these type of the cancers. Next one is Graves' disease. Graves' disease occurs in hyperthyroidism. Patient will have hyperthyroidism and as you can see, thyroid ophthalmopathy and exophthalmos in Graves' disease occurs. What happens when thyroid stimulating immunoglobulins like IgG stimulate thyroid gland too much, and it is type 2 hypersensitivity which is stimulated by thyroid stimulating hormone. And then there is peritibial myxedema, edema on the tibial sides, and orbital fibroblasts will be there. Increased cytokines, TNF, alpha, gamma, fibroblastic activity will be increased. Histology will be dull, crowded follicular epithelial with scalloped colloids will be seen in the hyperthyroidism. Okay, so the questions from past papers are in exophthalmos, what will be there? It is exophthalmos occurs due to increased thyroid stimulating hormone. Another one is a patient, his most common cause of hyperthyroidism is Graves' disease. In Graves' disease, there is hyperthyroid goiter exophthalmos. Common cause of hypothyroid Graves' disease. What will increase in Graves' disease? IgG and T3 will be increased in the Graves' disease. Immunoglobulins, excessive stimulation of the thyroid. Graves' ophthalmopathy has optic nerve compression. Next one is vitamin D deficiency associated with which ophthalmopathy in the patient? That is Graves' hyperthyroidism. vitamin D deficiency associated with ophthalmopathy, that is hyperthyroidism. Another one is hypothyroidism. It is against hyperthyroidism. Hypothyroidism decrease autoimmune thyroiditis, which results into association with HLA-DR3, and there is a risk of primary thyroid lymphomas. It results into non-tender enlarged thyroid gland. Hashimoto thyroiditis can also be there, and there are antithyroid peroxidase, antimicrosomal, antithyroglobulin antibodies, and then patient will have decreased T3 T4 level in the blood results into the hypothyroidism. So questions: how patient present a 40-year-old hypothyroid female patient to the endocrinologist, mass in the neck, FNSE shows increased lymphocytes, and serology advised. What is most probable causing? That is Hashimoto thyroiditis. Female with neck swelling, hypothyroidism, Hashimoto thyroiditis. Female with swelling in front of the neck, hypothyroid disease. Doctor having some immunoglobulin test, that is Hashimoto thyroiditis. And diagnosis of Hashimoto thyroiditis is antimicrosomal antibodies are the antithyroglobulin antibodies are for Hashimoto thyroiditis. Another one, a 40-year-old Hashimoto female referred to the endocrine mass in the neck. FNAC shows increased lymphocytes. Serology was advised. What is most probable cause? It is Hashimoto thyroiditis. Okay, next one is chemotherapy-induced diarrhea. Epithelial cell damage due to apoptosis. In von Gerke disease type 1, which enzyme deficiency will be there, which cause fasting hypoglycemia and lactic acidosis, that is G6 phosphate deficiency. Pyruvate carboxylase require which vitamin or coenzyme deficiency, that is biotin 2. Another one is Goods Pasture syndrome. Anti-GBM disease demonstrates which type of hypersensitivity? It is type 2 hypersensitivity. Third degree perineal tear. Which structure is involved? Anal sphincter complex. Which class of antidiabetic drugs has proven cardioprotective and nephroprotective benefits? That is SGLT2 inhibitors. An albino patient have reduced visual acuity and primarily due to decreased visual acuity. Primary cause is foveal hypoplasia. Which antiarrhythmic drug is most commonly associated with fatigue due to thyroid and pulmonary side effects? That is amiodarone. Okay, next one is which what is recommended in intrapartum management of GBS positive mother for prevention of neonatal infection. IV penicillin during labor should be given. In postpartum hemorrhage, complication of DIC, most appropriate management for blood products include FFP, platelets, and cryoprecipitate should be given in the DIC. A sacral fracture can most directly injure which pelvic organ? It can injure rectum. An anemic patient with normal ferritin, low TIBC, low serum iron, what is likely anemia of chronic disease is there because there is no low iron with hemoglobin, or we have excluded microcytic anemia or megaloblastic anemia. Thiazide diuretics can cause peripheral edema due to direct alveolar vasodilation. Vasodilation, arteriolar vasodilation leads to edema. First line empiric treatment for purulent urethral discharge is IM ceftriaxone with oral doxycycline should be given with the urethral discharge in the patient sexually active male. Gynecomastia with erectile dysfunction most directly caused by imbalance between imbalance in estrogen and low testosterone that results in gynecomastia erectile dysfunction. Which HPV test most frequently implicated in cervical carcinoma? That is HPV 16, human papillomavirus 16. Okay, next one is MHC class 1 molecule present antigen to the CD8 cytotoxic T cells. Which definitive therapy offers permanent resolution of Graves' hyperthyroidism? That is, radioactive iodine ablation should be done with the Graves' hyperthyroid disease. Next one is the middle meningeal artery enters into foramen spinosum. There are different openings of the skull: spinosum, ovale, lucidum, and rotundum. Foramen spinosum, middle meningeal artery comes outward. So this is very important to memorize. Next one is which vaccine is most effective in preventing hepatocellular carcinoma? That is hepatitis B vaccine is very effective. And ulcer on the tongue, which rolled margin intubated base suspicious of squamous cell carcinoma. Okay, next one is an ulcer on the tongue, rolled margins, indurated base, that is squamous cell carcinoma. Which organism most commonly associated with the late prostatic well endocarditis? Prosthetic well endocarditis, staph epidermidis. IV drug abusers are mostly prone to staph viridian. Which of the following organism mostly associated with the prosthetic, that is staph epidermidis? Which maternal infection most strongly associated with preterm premature rupture of the membrane? That is bacterial vaginosis is mostly affected with this. Okay, next one is painful genital ulcers, tender inguinal lymphadenopathy, characteristic is carcinoid tumor. Which antibiotic class inhibits DNA gyrase, topoisomerase, fluoroquinolones? A child with uh, recurrent sinopulmonary infection, absence of tonsils, that is Bruton, A gamma globulinemia. Which drug is most commonly associated with the acute tubular necrosis? Amikacin is most commonly associated. A complication of central venous catheterization in subclavian venous pneumothorax. Most appropriate investigation for recurrent hematuria in the smooth muscle is urine cytology with a cytoscopy. Which vitamin deficiency associated with angular cheilitis and glossitis? That is riboflavin, vitamin B2, cheilitis and glossitis. Now we will be looking at the image of. Okay, as you can see here, this is angular cheilitis and angular mouth infection at the angle of mouth. This is known as angular cheilitis, occurs in vitamin deficiency. Okay, now another one is Horner syndrome in lung cancer patients, suggestive involvement of cervical sympathetic chain. In Horner syndrome, there is cervical sympathetic chain involvement. Now, Horner syndrome, we will be looking at Horner syndrome. There is meiosis, means there is constriction of the pupil, ptosis, and anhidrosis. Horner syndrome, meiosis, ptosis, and anhidrosis. And third nerve palsy, there is same ptosis with anhidrosis, but there is mydrosis, dilated pupil in third nerve palsy. So there is difference between Arnold syndrome and third nerve palsy. You have to memorize this thing. Okay, next one is which hormone prevents lactation during pregnancy? It is progesterone prevents lactation during pregnancy. What is most likely cause of early postpartum hemorrhage? It is uterine atony can cause early postpartum hemorrhage. Most common cause of postpartum fever at 24 to 48 hours is endometritis. A painful genital ulcer, non-bilateral non-tender lymphadenopathy occurs in syphilis. Which is most likely cause of symmetrical proximal muscle weakness, elevated creatine kinase? It is polymyositis, proximal muscle weakness, polymyositis. So now we will be looking at the difference between polymyositis and Duchenne muscular dystrophy because it is very important to diagnose the. Okay, so the difference between polymyositis and Duchenne muscular dystrophy is polymyositis is autoimmune inflammatory myopathy, occurs in adults, more in female, and autoimmune T-mediated cell inflammation. While Duchenne muscular dystrophy is genetic, it is not autoimmune. It is not involved in T cells or B cells, while it is involved in X-linked recessive childhood disease less than 5 years. Male are most commonly X-linked inherited, and mutation in dystrophin gene results into this condition. So there is a difference between polymyositis and Duchenne muscular dystrophy. Now look at the question again, which is most likely symmetrical proximal muscle weakness with elevated creatine kinase at polymyositis.